This is Shelley Kraft coming to you live on SNNLive. We're at the Growth Capital Expo, Caesars Palace, Las Vegas 2016. I have with me Dr. Glynn Wilson, TapImmune. It's a publicly traded company, and the symbol is TPIV. Glynn, welcome back to SNNLive.
Thanks, Shelley. It's a pleasure to be here.
And it's good to have you. So let's get an overview on TPIV. I like to use this symbol.
TapImmune is an Immuno-Oncology company with state-of-the-art technologies for developing T-cell vaccines to stimulate the body's own immune system to go and fight disease. The technologies were licensed from the Mayo Clinic, and so we've had very good partners to get us to this stage.
You know, it's been a while since I've seen you and interviewed you, so over the course of that time period, has anything happened in the company that you'd like to tell us about?
Some very exciting developments. We recently announced a phase 2 clinical collaboration for a combination study with our TPIV 200 vaccine and a checkpoint inhibitor from AstraZeneca. The studies will be done at Sloan Kettering, Memorial Sloan Kettering in New York, starting very soon, and they'll be in ovarian patients that really have failed most other therapies. So we're very excited about that, simply because we believe the future is going to be combinations of agents, such as vaccines and the checkpoint inhibitors, which take the brakes off the immune system. In addition, we're starting our own phase 2 studies on TPIV 200. We've recently opened 3 sites that we're starting to recruit patients into, and we'll be starting those very soon. So if people go and look at clinicaltrials.gov/TapImmune, they'll see that those trials are now recruiting.
So in general, how has the progress of TapImmune affected the clinical trials of where you are going in cancer treatment?
Well, I think we completed 2 phase 1 studies, one in HER2 breast cancer, the other is in ovarian and breast cancer. The results of those showed that over 90% of the patients had robust immune responses to the vaccine. That prompted the Department of Defense, for example, to give a $13.3 million grant to our collaborators at the Mayo for a large 280-patient phase 2 study on the TPIV 200 vaccine. In addition, the results that we obtained for our phase 1 studies, also prompted AstraZeneca and Memorial Sloan Kettering to do this partnership that we've just talked about.
You know, over the course of time, I've known you to be very humble, and in running a public company, I think that's probably of benefit. But what do you see over the course of the balance of 2016, 2017? And I know it could be forward-looking, so only tell me what you can, but I'd like to get your sensibility if I could.
Well, clearly we want to bring the phase 2 studies that we're starting, get them to a point where we can get the readout of what's happening. Our own studies are open label, so we get to look at those as we go along. The large phase 2 study at the Mayo Clinic, funded by the Department of Defense, is going to take much longer. But the other study that we plan to start this year is in ovarian cancer. We obtained fast-track designation from the FDA for a particular development program. We hope we'll start that. That'll be in patients that are on traditional platinum therapy, and we'll be looking at the combination with the vaccine for maintenance therapy. In addition, we have a very exciting preclinical technology called Polystart that was developed in-house. We recently received patents on that, and it's a brilliant technology that increases the amount of antigen that the T cells can see, so it increases the signal for promoting an immune response. So we're very excited about that. It has many, many different applications.
Glynn, for more information, let's give out your website, if you would.
Yes, for more information, people can go to our website at TapImmune, TapImmune.com.
Ladies and gentlemen, Dr. Glynn Wilson, TapImmune. It's a publicly traded company, and the symbol is TPIV. I'm Shelley Kraft. This is SNNLive, and we're coming to you live from the Growth Capital Expo, Caesars Palace in Las Vegas 2016. It's always a pleasure. Thank you for coming on.
Pleasure's all mine, Shelley. Thank you very much.
Thank you.